In that analysis, you show a significant gap between the cost patients would have absorbed under premium support compared to traditional Medicare. Ms. Schwartz went into this a little bit. Your analysis shows traditional Medicare continuing to operate well beyond 2020 when the program's trust fund becomes insolvent. At the same time, your report before us today says, quote, once the hospital insurance trust fund is exhausted, the Centers for Medicaid and Medicare Services will no longer have the legal authority to pay health plans and providers, end quote. In a separate analysis, you warned, quote, a growing level of federal debt would also increase the probability of a sudden fiscal crisis. Yesterday, the trustees in Ways and Means confirmed in a hearing that Medicare, as we know, ends in 2023, and that's the quote. So I've got three basic questions on this part. If Medicare's trust funds are empty, and paying for Medicare's unfunded promises requires tens of trillions of dollars to be transferred from general revenue, where will these funds come from, number one? Number two, how would Medicare be financed amidst a fiscal crisis? And is it plausible that Medicare can continue to provide current benefits indefinitely, as your analysis assumes, in comparing it to our premium support plan?
So on the first question, Mr. Chairman, if the trust fund runs out of money, then the only way that benefits will be continued at the level specified in current law is if general revenue were used for that purpose. And that revenue can only come from higher taxes or lower spending on other programs.
Or more borrowing.
Or additional borrowing. And that leads to the second part of your question, which is what happens in a fiscal crisis. If the government becomes unable to borrow at affordable rates, as we have seen some other countries end up in that position, then there would probably need to be very stark changes in the whole range of government spending programs and stark changes
in the immediate term at the time.
Right away, when that situation arises, the government cannot turn to capital markets to obtain the funds that it needs, and it tries to then balance the budget almost literally overnight, then the disruption to the federal government's policies and to the economy and society can be immense.
So this is unsustainable.
The path that the budget is on under current policies is most definitely...
In the Medicare baseline itself.
So Medicare, the Part A of Medicare, funded through the trust fund, is on an unsustainable path. In our own projections, the fund is actually exhausted in 2020, a few years earlier
right, than
the actuaries